Senator Hickenlooper.
Thank you, Mr. Chair. Thank you, Dr. Bhattacharya. You've previously described the mRNA platform as promising technology. There's recent research coming out of the University of Florida, MD Anderson Cancer Center, that suggests that there's additional benefit from mRNA vaccines in terms of the body's immune response to cancer. In our recent past, NIH researchers have conducted numerous studies on the platform, mRNA, and that research has been used as the basis for vaccine development projects at the Biomedical Advanced Research and Development Authority, BARDA, to great success, and goes back through, I mean, some of that research actually goes back to the University of Colorado and Tom Cech, and then through Jennifer Doudna and Emmanuel Charpentier, and you have a Nobel Prize in there somewhere. And yet Secretary Kennedy has canceled all of the mRNA projects at BARDA. So $500 million of research got canceled. What's up?
Well, first, Senator, we have not canceled the mRNA. So, for instance, we have research projects at the NIH for mRNA for cancer vaccines. It seems to me like quite a promising technology. I mean, we'll see if it works out, but that'll depend on nature. But we haven't stopped our research on cancer vaccines for using mRNA.
Okay, but you're again, aren't you concerned that we're taking $500 million of research already in projects? PhD students are 2 years, 3 years into their PhD, and their research is stopped. You're talking about trying to keep young people excited about the field. How are you going to address that?
Well, I mean, I think, Senator, if you're asking me about the BARDA contracts, of course, I'm not on charge of BARDA, but I'll say that refocusing the money on places where people trust the vaccines makes more sense to me, right? So the mRNA vaccines for COVID, for instance, had very, very low uptake. So it doesn't make a lot of sense to invest in a technology. Instead, invest in technologies where that are promising, that have already much more public trust. Seems like a better public health investment. That's separate from the NIH investment. The NIH investment is about research for the future, better vaccines, better treatments for cancer, and that's where I've focused my efforts.
Got it. I guess I'm concerned about that uptake. That you're saying there's not as much uptake with the mRNA vaccines. I don't think there's any science that backs that. So we should all be concerned about that and make sure that we are pursuing those delivery vehicles that are the most successful. Let me switch to the Include project, which we've discussed and aware of. It's an effort to make groundbreaking discoveries about conditions that disproportionately affect people with Down syndrome, as one example. Things like Alzheimer's disease, the probability that they will get Alzheimer's is dramatically higher. So led by the Office of the NIH Director, the Include project brings together multiple NIH institutes under a coordinated approach that is delivering significant scientific discoveries and new treatments simultaneously. And we've worked hard to advance the bipartisan DeAndre-Dixon Include Project Act, which would finally codify this, I think, extraordinary initiative. How can the Include project serve as a model at NIH for improved scientific collaboration and return on taxpayer investment?
I mean, it's a wonderful project, Senator. As you know, when we spoke, I wholeheartedly support it. I mean, I think the reason why it works is because it does involve work from multiple institutes, right? Collaboration with the National Institute of Aging, with the National Institute of Child Health and Development. I mean, so it's kind of a model, and other institutes as well. It's a model of scientific collaboration that can happen only at a place like the NIH. I've been working to break down those walls, not just for the Include project, but for so many other. The long COVID projects, for instance, is a good example,
right,
involving multiple institutes. It's the NIH. You know, it's so easy when you're in academics to just focus on your field.
Right.
But that's not how you get big advances. You get
right, well, I hope the congressional report language directs NIH to fund no less than $90 million for the Include project, and calls for increased baseline research funding for Down syndrome. Hopefully, we can stay focused on that. I do feel I hear this from people in Colorado all the time, that they feel there's a war on science in Washington. They feel that there's kind of widespread, reckless disassociation or deconstruction of some of the foundations of our research. So I know from our conversations you share the concern and probably disagree with how real the threat is.
I guess I'd say come spend a day with some of the scientists at the NIH. There's no war on science. There's just a desire to have our science really help the American people get healthier. That's what I've seen every day at the NIH.
Great. Well, thank you for your work. Appreciate it.